Hi. Okay, so the GI system for the baby is really, really difficult part to assess because at the beginning it really doesn't seem like a big deal, and then it actually, once you start feeding the baby, lots of things start coming up. But initially, you do want to inspect. You want to look for symmetry in the belly, and actually, this is not a great baby because the arms don't move so much. But you can see right here, you want to look that the belly is rounded and that it's equal and symmetrical. You want to make sure that the belly is not concave. If it is sunk in, that's sometimes it is because of a congenital diaphragmatic hernia, and so that is not normal. You want to examine the umbilicus. The umbilicus should have two arteries and a vein. And if it doesn't, that's another thing that they will follow up on. Then you want to auscultate and listen to bowel sounds. Sometimes it's hard to divide a neonate's belly into four quadrants like an adult, but you do the best you can and just listen to bowel sounds. And again, if you hear bowel sounds all the way up in the chest area, again, that is indicative of diaphragmatic hernia. So you want to make sure that the bowel sounds are actually in the abdomen area. And then you do want to palpate, and you want to, palpate, and just when you palpate gently to see, does the baby cry? And the baby does cry a lot when they're first born. So sometimes it is hard to say, does it hurt them or does it not hurt them, because they can't really speak. But you do want to palpate and see, are they reacting more than they were crying before? But you definitely want to feel for any kind of lumps. You want to feel for the spleen. You want to feel for the liver. You want to feel if one side is equal. And again, just like you're looking at the face, just like you're looking at other parts of the body, you want to feel for symmetry. That, when you're pushing on one side and you're pushing on the other side, that they feel pretty similar. Percussion is not done on the bellies of babies, mostly because the size of the body, there's just a lot of air in there, and that's mostly what you're going to hear. You're not going to hear a difference. So inspection and listening is a big part. Bowel sounds usually aren't heard for, until about 2 hours after birth, but you can hear them even if they're not as, active at the beginning. And then also, some babies, unfortunately, are born with abdominal wall defects like an omphalocele or a gastroschisis, so you want to note. But usually we know that before the baby's born, and you're prepared for that.